So this is our last service event for the semester. Pretty sad that we couldn't do anything in person, but I'm excited for this one. It's a little different from our usual card making. Um, for anyone that's been with Georgetown Right to Life in like a normal semester, we work with the Northwest Center a lot for diaper drives, mostly that we do monthly. So we're excited to have Miss Gallucci here today. She's been the director for over a decade, I think, if that's right. So she's just going to talk a little bit about their work and how the COVID-19 pandemic has impacted the center. And then we'll open the floor to questions. And if you just want to send your question directly to me or raise your hand on Zoom, I'll call on you later. So you can get started whenever you're ready, Susan.
All right. Well, thank you guys for having me. So, I just celebrated 15 years at the Northwest Center and was thinking about it because I went to Georgetown and I first heard about the center volunteering. There was a fourth credit option. I don't know if they still have it, but I was studying psychology, so I got a fourth credit if I volunteered every week and met with my professor, which was great because psychology was such a big class. And so I really got to know him. He was a Jesuit. He just passed away in December. He was 93, but we kept in touch that whole time. So I really got to know him and I got to know the center. And then I later studied, I got my master's in social work at Catholic, worked for Montgomery County, and ended up coming back to the Northwest Center because I love it. So it was so great to go back and still see the connection with Georgetown. So it's just, we couldn't do it without you guys' support. And I know it's changed during COVID and doing those diaper drives, but still thank you for finding creative ways to support us and to get that pro-life message out there. It makes such a difference, especially on a topic that's so controversial, to be able to say this is what it means to stand by someone for life, and this is what it means to support women, is to be non-judgmental. And if they're pregnant, talk to them, or they might be pregnant, talk to them about their fears, talk to them about their hopes, talk to them about the pressures being put on them. And then we really try to help them with the material assistance like the diapers. And then I run the maternity home program, so the transitional program where they can live for 18 months when they're pregnant and going on beyond that. So for those of you who don't know, we're a townhouse in Adams Morgan. We typically will see, we're still seeing on the phone about 65 families a month, so a lot of families. In the pregnancy center program, we call that step up. We check in, making sure they're going to the doctor, they're connected to a doctor, they have insurance, basically the whole social service things. And then at the end, they get diapers and baby clothes and things like that. And then the upstairs of the house is where the women live when they're pregnant. So when COVID hit, it was just like, what do we do? So we closed our doors, but we're still doing the phone call appointments with people, especially because people had even more needs as far as like food and paying rent and losing jobs and needing PPE, things like that. So we just talked on the phone to connect people. And then after maybe a month, we started doing the curbside pickup, which is what we're still doing. So we have those appointments. We're pretty low technology level, so we haven't done video. We're thinking about doing it now, but we also think our clients might like the pressure of not being on video. And you hear stuff in the background, especially if there's school age kids. So maybe it's just easier, but we'll see. And then twice a week, my coworker Maria will get all the items together and they will come to pick them up. So it's different. I mean, I think it's easier for some people because they don't have to get to us to get to that appointment. The pickups, it's like a 4-hour slot on Wednesday and 4 on Friday. They just come anytime during that time. So it's more flexibility. So we are finding that people are showing up for their phone appointments more, which is nice. And then again, really just, we always talked about food and about housing, but lately it's been like, okay, there's food distribution here, or there's more diapers here, or that type of thing, or just empathizing how hard it is. Of course, the people we see are pregnant or postpartum, so walking them through that, because especially at the beginning, I mean, they're learning more now about COVID and pregnancy and now vaccines and pregnancy and breastfeeding, but there was so much that wasn't known. And a lot of our clients, most of them are lower income, a lot of are immigrants, a lot don't speak English or don't speak English well. And if you can imagine, like, I know at regular doctor's appointments, I feel rushed sometimes. So when women are going in and for prenatal appointments, a lot of times they don't feel like they have the space and the time to ask their questions. So really trying to help them have better birth outcomes, have better information. We're not medical, but trying to tell them what we've read and encourage them to ask their doctors, get help to transportation to appointments, things like that. And then the maternity home changed. The moms, I house up to 4 moms at one time. Sometimes they're college students, sometimes they're not, just all different circumstances why they don't have a place to stay and they're homeless and they're pregnant. And it just, with lockdown, right? It was like, well, you can't stay at someone else's house and you have to minimize grocery trips and you have to wear these things. And I know for me, like they have rules, they have a curfew, they have chores, they have certain things they have to do, but I was never like, where are you going? Are you going inside someone's house? Are you going to wear a mask when you come in? Are you going to wash your hands? So it's been awful as far as the restricting at the beginning of saying, no, you can't go hang out with your friends at their house because it's not safe, especially when we're on lockdown. So that, and then there were all of the protests for George Floyd, all the racial justice marches, and not a ton came to Adams Morgan, but at the beginning and when there was some of the there was a liquor store that was broken into. So when there was some of that damage, the moms are all looking at me like, what are we going to do? And I'm just like, I don't know because I've never dealt with it, but we'll figure it out. So talking to other like group home places, Christ House, which is for people, mainly men, but some women who come out of the hospital, and the hospice, Joseph's House down the street, what are they doing for safety precautions? I mean, we have bars on the windows. So figuring that out. And then at the same time, most of the women I serve in the maternity home are African American, and talking to them about, well, what does this mean to you? And one, she wanted to protest and she wanted to be out there, but she had an infant. And so she didn't, because of COVID, she didn't want to expose him to anything. And trying to talk about more, I mean, I tried to as a social worker, but it really made me stop and say, just because I'm white, like, I can't not talk about this. I need to ask them questions. I need to hear where they're coming from. I need to learn how to advocate or what, self-examine. What am I doing as someone who's white and has power, and what should I do different? So that was a whole nother piece added into it. So yeah, figuring out with vaccines, letting people know about vaccines when they're eligible, talking with them because they have all different opinions about it. What do they feel about it? What do they think about it? Yeah, it's just been like it has for all of you, right? With your life is just different. And so running a program and finding out how it affects people. We did have a lot of families in the pregnancy center. Either they got sick or they had a family member. I remember one woman whose brother, who was, I think, in his 20s, got really sick and was hospitalized and then was in rehab and still had scarring on his face or somewhere from like the tubes. And that was really traumatic for her. Other families who got behind on rent because the whole family got COVID and couldn't work for a month. So it's definitely been touching people. And then when people get stuck in the house, they don't want to even go for walks, some of them, because of COVID. And if they're pregnant and babies don't have masks, I mean, it's somewhat safer for children, but still wanting to protect them. So yeah, it's been a lot, but thankfully all the moms at the maternity home who had babies in the spring last year, they all had healthy babies, thank goodness. And everyone in the maternity home has been healthy. No one's had COVID, thank God. And again, I think we're really good on what the procedures are. And yeah, I told that group of moms, like living through a pandemic with them, because I would go to work at the beginning 3 days a week and then work from home, but I don't wear a mask and they're like they're in my bubble. So kind of having survived it with them, and of course watching the babies grow, which is always a lot of fun. And the babies, like, they're used to it. They were born and people were wearing masks. So they're used to it. They still try to pull it off when I come in, but it's more of their norm, which is really interesting. So that's kind of my spiel. Happy to answer questions. Not sure if I hit on everything.
Yeah, thank you. Do you mind telling us just a little bit more about the center and its history before you? Just really briefly.
Yeah, so it's founded in 1983 by students and alumni of Georgetown. They saw that there were abortion clinics, but there didn't seem to be alternatives. So St. Stephen the Martyr, which is on Pennsylvania Avenue near GW, it was started in the basement there. They did pregnancy tests and what we call options counseling. So talking to a woman, if you are pregnant, you can continue and parent, you can continue and adopt, you can have an abortion, because we're going to talk to her. What does it mean to you to have an abortion? Do you know what the abortion procedures are? Do you know what fetal development is? Under no circumstances do we ever refer for abortion, but she needs to think about it, right? She needs to process and she needs to have good information. So they found, apparently, after that first year in 1981, because we're celebrating our 40th year, so that was 1981, that women needed so much more. They needed diapers, they needed referrals, so they expanded into a pregnancy resource center in its own location and started seeing more families, doing more than just the pregnancy tests. Then they found that a lot of people who were coming for pregnancy tests were saying, I'm going to have an abortion because my mom's kicking me out, or my grandma, or I'm couch surfing. They say I can't bring a baby there. And how horrible to have to choose between your pregnancy and your housing. So they opened the maternity home in 93. And the location we are in, Adams Morgan, bought that property in 97. So both programs are in that same building. So it's really great if Maria's doing a pregnancy test and the woman's like, I don't want to have an abortion, I'm going to get kicked out. She does have to interview for the maternity home. Like, she can't have active drug issues or major mental health stuff. And so if we can't house her, I try to find somewhere else to house her. But it came out of, again, that direct need. And I think it's really nice to have them both together because they really complement each other.
Thank you. Does anyone have any questions? Carrie?
Yeah, I have one question. Just to start, I have many questions, but to start, could you maybe speak a little bit more about the scale of the program? Because I remember you said you've been seeing roughly 60 to 65 families virtually. Is that an uptick or a decline from pre-COVID? And either way, like, why do you think that's the case? And then another just kind of sub question is, on average, how many women would you say the maternity home sees at a time?
Great questions. Yeah. So we didn't see an uptake. We got more phone calls with COVID last March, April, and even in the summer about people. So just to manage the program, the woman has to be pregnant or have a child 3 months or under to enroll in the pregnancy center program. We can make exceptions because we're small, but we'd have too many if we didn't have that. And again, we try to connect them to somewhere else if we can't serve them. So we got more people who didn't qualify, who sometimes we just gave diapers to or connected to other resources. We were expecting the pregnancy test numbers to go up at some point post-pandemic, but we didn't really see that surge. Not quite sure why. We typically have the pregnancy center director and then a full-time either Jesuit volunteer. So if anybody post-college, I did Jesuit Volunteer Corps, highly recommend it. Or we had someone from the Capuchin Volunteer Corps. We were supposed to have someone, it goes August to end of July, but the DC House didn't have enough volunteers. So we don't have a full-time volunteer. So we are seeing less people. I've been seeing people to help out, and we hired somebody 10 hours a week. So we've managed, because Maria is an amazing person, to see about the same numbers that we usually see, surprisingly. So again, a kind of an increase in people needing other services, and then our own clients who know us needing more, just more things. Oh, in the maternity home, typically I'll serve about 4 women a year. It kind of depends. They can stay 18 months, some stay 6 months, some stay 18 months. We've served about 90 women and 90 babies since the maternity home opened in 93. And the Northwest Center altogether, like mom, we do see some dads and babies. We've served like 60,000 people in the last 40 years. And thank you to volunteers, because we couldn't do it. Whether you're doing a diaper drive one time, or you're praying for us, or you're coming in the center on a Saturday to help, like one-time volunteers, weekly volunteers, we would not, our staff is way too small. We wouldn't be able to do the work. Anybody else? Or Mary, you were there on Saturday. Anything you want to share or be like, I didn't know it was this little tiny basement with bins of clothing?
Yeah, I mean, I learned all sorts of stuff about, I've never really worked with baby anything, so figuring out what different clothing items are for confused me greatly. But I was curious, like, how the finances worked in terms of, like, how much does it keep or cost to keep the lights on, and where do you get most of the money coming in from?
Yeah, great question. So we started to get a couple of years ago, we had a small government grant that's emergency food and shelter program. So about $7,000. It varies. Sometimes it's less a year for providing the shelter. But other than that, no government funding. We do get a couple of grants. We have, some of you may have known in the past, we'll have Georgetown Students Week. Used to have a big gala at the Organization of American States every October that's black tie, that raises money. So we'll have that and a smaller fundraiser in July, mailings that go out. So regular donors, some small grants. We own the building, which makes it easier. So our budget's pretty low. There's like utilities, a lot of the money goes to staff, not that we're making a ton of money, but we're providing the services. And then items like the baby clothes, the diapers, we don't purchase any of those, but we give them out. And not diapers, but certainly clothing and high chairs and things like that. Like babies grow out of clothing in 1 to 3 months. So they're really reusable, and people in the community are happy to donate them. So our budget is just under 300,000, and we're 3 full-time, 3 part-time. So we can do a lot with a little. And there have been times our budget has been hardly there, and we're not a faith-based organization. Like, we follow Catholic social teaching, we're pro-life, but we're not explicitly faith-based. It so happens right now all our employees are Catholic, and they generally are. But sometimes I'm just like, how are we going to make it? And then by the grace of God, like, we get some big grant, or someone left something in their will, or we're blessed with something. So I'm just like, yeah, God wants us to be here, but not get too comfortable. So.
I have an additional question, if it's okay. Also, thanks for saying that. That makes a lot of sense. I was going to say, where do you see the most need? And kind of a follow-up question to that is, like, what can we be doing, either as an organization or like as individuals back home, to be serving this need more?
When you say need, you mean, talk more about what you mean.
Like, specifically supporting moms in need, but more broadly, even like supporting the pro-life cause. Because I know there's many different ways, but one aspect of that is like supporting, and I think you mentioned like walking with women through this. Like, how can we do that?
Yeah. So there are tons of different ways, and I think it can be very individual. So it's anything, right? We need people who are doing the legislative piece. We need people who are praying outside abortion clinics. I think with 40 Days for Life and some of the being outside of abortion clinics, that's changed. I don't think it's helpful to dress like the Grim Reaper or to have photos of aborted babies. Like, you don't want to be traumatizing to the women going into the abortion clinic, because there's certainly, I can't even imagine how much emotional stress they're going through. But there are people to pray out there, people to say, hey, if you want to do this, we'll help you figure it out. There are volunteers at the center. And then there's conversations, right? So I talked about racial justice and having uncomfortable conversations. I think it's having conversations with people about abortion. Again, it's such a hot button issue, but when can we bring it up? And I think it's so important to listen. I always say you never know when you're talking with someone if that woman has had an abortion, right? And abortion takes healing. Every woman is individual, but it's a hard choice if she chooses it. So she's got to deal with it whatever way. And I think as a society, we have to say it may be a loss. It may be a huge loss for her. It may not be, but let's give her the space to grieve or do whatever work she needs to do, and to honor that it might have been painful emotionally. We're not saying it has to be, or you're going to feel this way. So listening to people, there's a lot of misconceptions out there on both sides. I mean, there's science. Fetal development is fetal development is fetal development. Like, that's just how it is. And, looking at biology, looking at, having this conversation. Why is it important to the person? And if they disagree, what are their arguments? And when can they hear us, I always say talk about adoption more. Like, adoption is so beautiful. Adoption is not easy for the birth mom at all, but it's a brave, selfless decision. And when can we talk? Like, I know TV shows do it now more in movies, but I still think there's this big stigma. Like, if a birth mom makes an adoption plan for her baby, and it's just like that, why is she stigmatized? She did this heroic gift. And now it's a lot easier with open adoptions, I think. And so she can have contact and know her birth children and they can know her. But so I think talking about adoption more, normalizing it, having those conversations when they come up, and then seeing what the need is. Some churches have Gabriel projects. With the Northwest Center, people can go through the counselor training. They can come in and donate things. They can collect diapers. They can, if we have other needs like collecting more, we don't right now, but collecting more baby clothes. And then I'm trying to think what else, like, yeah, where you live, is there a maternity home? Are there things? When it wasn't the pandemic, I had a volunteer who really liked cooking. Like, she put that on her volunteer application. I had two moms who really wanted to learn how to cook. So she would come in, I would get the groceries, and they would make a big meal together, and everybody loves eating. And then just looking in your life, what I find, the women in the maternity home, at least because I'm more involved with them, what they need more than anything is a babysitter. Like, single moms never get a break. So they need someone just to watch a child for an hour so they can have a break, or they can take a shower, or they can do whatever. And then when they were using daycare, when daycare was closed for teacher training, but they had a job that wasn't going to really let them take a day off, or they didn't have any vacation, filling in, or if the baby was sick and couldn't go to daycare. So people, even people who are, who are married or it's planned, when can you say, hey, I just feel like I'm going to make a bunch of lasagna. Can I bring you some this weekend? Or I'd love to come over and play with the kids for an hour on Saturday. Would that be okay? Or when would be good? Like, thinking about what people need who are parents. And if you're not sure, you can ask them. But I think with new parents, you can always bring them food, with parents after a while too. So it's a lot. I mean, I'm a spiritual person, so I would say kind of pray about where that need is, what your gifts are. And yeah, if you have any classmates who do have kids or have a baby, or even have responsibilities taking care of younger siblings, what can you maybe do to help out a little bit?
Yeah, I think that's really helpful, especially thinking about classmates, and just what we can do on a day-to-day, because sometimes it's so intimidating to make this year-long commitment, and that's something we should all consider. But yeah, those were really helpful. Does anyone else have any more questions? I know some people just came in. If not, I have one more. I'm sorry if you already mentioned this, but most of the women that you see coming through your doors, probably mostly for the pregnancy center, where do they hear about you? And how can we spread the word, or where should we do that?
That's a great question. So we do ask them. There's a huge word of mouth, especially so about half of our clients are Hispanic in the pregnancy center. And then we also have a big Ethiopian population. And in those, like, especially immigrant communities, huge word of mouth, but also, and then the internet, of course, and also hospitals, other social service agencies. I mean, we have been connected. Georgetown has such a good program. I know they've worked with Feminists for Life before, so that, there's housing for women for students who have babies, and they can use daycare. And so the health center really should know about us. But I mean, if you're there on campus ever at the health center and you happen to be there, you could always say to the nurse or whoever is seeing you, hey, do you know about the Northwest Center? Or do you know where to send people if they're pregnant or have these type of social service, obviously not medical questions?
Yeah, thank you. So with that, I think no one else. Cool. Well, thank you for your time. And this we recorded this event, so it'll be up on our YouTube channel. We can send you a link if you want. And yeah, thank you just for spending the night with us.
Yeah, well, thank you guys so much again, what you do. And as an alum, I appreciate you guys carrying on that torch. And anytime you have questions, definitely, reach out. But every little bit you do does make a difference. So, all right. Thanks, guys.
Thank you.
Bye.